Well, good afternoon, everyone. Joining Dr. Ezike and me today are three guests who will offer an update on our testing output and the geographical distribution of testing in Illinois. The folks who are joining me today are the Chief Medical Officer of the University of Chicago, Dr. Stephen Weber, the President and CEO of Howard Brown Health, David Munar, and the President and CEO of the Illinois Primary Healthcare Association, Jordan Powell. Before we get into today's news, it is my solemn responsibility to report that we lost 125 Illinoisans to this virus over the last 24 hours. These are family members and loved ones, neighbors and friends. Today we mourn with their communities, and we offer them our solace and our strength in this very difficult time. May their memories be for a blessing. Today I will also be reviewing our PPE procurement, but before we dive in, I want to let everyone know about an important new multi-state initiative. Earlier today, I, along with Governors Gretchen Whitmer of Michigan, Mike DeWine of Ohio, Tony Evers of Wisconsin, Tim Walz of Minnesota, Eric Holcomb of Indiana, and Andy Bashir of Kentucky, announced a formal partnership to reflect our ongoing regional collaborations in response to COVID-19. We are committing, all of us, to work in close coordination as a region to most effectively reopen our economy with a fact-based, data-driven approach. Each state will design its own plan, but with shared priorities: the ability to test and trace on a widespread basis, holding down infection and hospitalization rates, enhancing healthcare capacity to handle a potential resurgence, and a continued emphasis on social distancing in the workplace and elsewhere. I'm grateful to my fellow governors for their willingness to work in partnership. We are all in close contact with our colleagues in neighboring states and working to expand our collaborative efforts in this regard. On to today's update. Let's start with PPE. It's vitally important that we keep the PPE supplies flowing for our first responders, our healthcare professionals, and our frontline workers. And as a refresher, we're looking at a statewide 10-day PPE burn rate of just under 1.5 million N95 masks, 25 million gloves, 4.4 million gowns, and 700,000 surgical masks. And that's just across our hospitals and our long-term care facilities, with additional set-asides for our law enforcement and essential state workers and state-run facilities. We've now delivered PPE to each of our 102 counties in Illinois from the state stockpile, supporting the existing PPE supply chains and stocks at various healthcare facilities and local health departments, along with city and county emergency management agencies and all the regional healthcare coalitions. In sum, we've sent out more than 10 million items, including 5 million surgical masks, over 1.5 million N95 masks, nearly 20,000 gowns, over 4 million gloves, and nearly 200,000 face shields. We also have outstanding orders due to arrive in the coming days and weeks, with an additional 27 million N95 and KN95 masks, 27 million surgical and disposable masks, 8.4 million gowns and coveralls, 23.5 million gloves, and 7.5 million face shields. Although these are appropriate and seemingly large orders, I want everyone to understand that we don't count these orders in inventory until the shipments actually appear in our state warehouse. As you know, COVID-19 and the lack of federal organization of the supply chain have truly warped the market. As a result, we rarely have the luxury of going directly to a manufacturer or even a distributor to place an order. Under the current circumstances, procurements are often made now through multiple layers of connections. One distributor in the U.S. will know another distributor in another country who knows someone with a warehouse of masks and gloves. Our state procurement team has to track down these leads, vet the source in a very short time because they're competing to get the available goods first, and then they have to figure out how to ship the goods from point A to point B. It's not ideal, but our team is succeeding in a number of highly competitive situations. Next, let's talk about testing capacity. That means machines and labs, which, as you know, are critical components of both our response right now and our medium-term path to get to the other side of this crisis. Last week, I walked you through how our world-class researchers and scientists were collaborating with Thermo Fisher to identify and address the efficiency and reliability within the company's machines, a critical component of our testing expansion plan. I'm pleased to say that Thermo Fisher was not only extremely helpful in working with us to improve these testing procedures, but also committed to prioritizing Illinois as its customer. Those 5 machines that we had concerns about are now up and running with reliable results. So reliable that as we ramp up over the next week, we're estimating additional capacity of thousands more tests per day at our state labs alone. You've heard me talk about the fact that machines and labs are only one part of ramping up testing in our state. We've also needed to find adequate supplies of items necessary to take specimens. Over the last month, obtaining the raw materials for specimens, notably viral transport medium, called VTM, and swabs, has been difficult. However, I'm incredibly proud that my team has now managed to virtually eliminate our supply chain problems for VTM and swabs. Our university partners of Illinois Tech, Southern Illinois University in Carbondale, and the University of Illinois at Chicago, and University of Illinois Urbana-Champaign, as well as outside vendors, have committed collectively to providing us with enough VTM and swabs that we can not only stock our own state labs, but support additional labs throughout the state. This means even more specimens being taken for testing. And I want to invite labs who need our VTM and swabs, because many out there do, they should come and request it through their local emergency management agencies. They'll be able to obtain it and provide it to you. The next and final piece of this is the need to increase the number of locations available so that people can give the specimens that then get tested. With our increased capacity of machines and labs and the new supply of raw materials, we now can take more specimens to test. It's a great place to be at, having the ability to expand testing sites now that we can run more tests. I'm pleased to say that the guests here who are with me today are partners in our statewide efforts to broadly increase participation in testing to reflect our newfound capacities, especially in African American communities and other communities that face significant structural challenges in accessing health care. We're utilizing our incredible statewide network of federally qualified health centers to launch new testing locations in communities across Illinois. These new sites will feed specimens to our network of expanded laboratory capacity. In coordination with the Illinois Primary Healthcare Association, we asked which of the over 300 centers would be interested in helping us expand testing. An overwhelming number of them were eager to help. We now have sites coming online across Chicago, the Collar counties, Peoria, and in Southern Illinois, with many more centers expressing interest and working to get their operations up and running. An up-to-date list of these sites will be online at coronavirus.illinois.gov. And I want to remind everyone that if you think you might need a COVID-19 test and your symptoms are somewhat mild, please call before showing up. And while each independent provider can and will offer tests with their own unique criteria, the state of Illinois has expanded those eligible to get a test to include anyone who has COVID-like symptoms, even if you have not been given a doctor's order. This will apply to our state-run drive-through testing centers, and it is guidance that we will now be offering to providers all across the state of Illinois. 2 days ago, we opened our third state drive-through site with excellent turnout. The new site in Markham, in Chicago's south suburbs, took over 600 specimens in its first day of operations. Now, I want to put that in perspective. That's about 4 times what the federally run sites were doing previously. With this new site, our drive-throughs now have the ability to run up to 1,800 tests per day. These sites have produced terrific results for us, and in the coming days, I'll be announcing 2 additional drive-through testing sites as we continue bringing that success to new regions and new areas of Illinois. Folks, this progress on testing isn't all the progress that we need to begin on our path back to normal, but this is truly an important step to help us get there. Until that day comes, please take comfort in the fact that you're helping to make a difference, all of you. Your individual efforts to stay home, wash your hands, keep your distance, and wear masks are what is flattening our collective curve. The day we can begin our path back to normal will come sooner because of your actions right now. So I ask you to continue to tap into your courage, your sense of community, your generosity, and stay the course. We will get through this together, all of us together. Thank you very much. And